Before handing over to the WHO Regional Director for Europe, Dr. Hans Kluge, to make his opening statement, I'd like to invite His Excellency, the Minister of Health of Israel, Mr. Nitzan Horowitz, to say a few words. Sir, if you can stand up to the podium, that would be great. Thank you.
תודה רבה, בוקר טוב. Ladies and gentlemen, Israel is honored to host this important conference of the WHO Europe Regional Committee. We welcome the opportunity to advance relations and promote collaboration with the World Health Organization and our friends and partners around the world and in Europe in particular. This is an exhibition of our commitment to our shared values and providing high quality and equitable health. So far, today, this is the last day, so far it was a very successful, in-depth and enriching conference. I would say an amazing event. We had fruitful bilateral meetings and agreed on meaningful regional actions plans. As far as I can say, and this is not the end, this conference was extremely productive and met all our goals. Countries strengthened their relations, connected and shared the newest knowledge in the fields of health. Allow me a few words in Hebrew. זאת זכות יוצאת מגדר הרגיל לארח את הכנס של ארגון הבריאות העולמי בפעם הראשונה בישראל. עד לפני זמן קצר אירוע כזה בארץ היה בבחינת מדע בדיוני. יש לזה משמעות אדירה עבור מערכת הבריאות הישראלית ועבור מדינת ישראל. ההיענות הייתה מדהימה, עשרות שרים ומשלחות מ-53 מדינות אירופה הגיעו, השתתפות המונית, והכנס היה מוצלח ביותר. המדיניות שהובלנו בקורונה והיכולות של מערכת הבריאות הישראלית מאוד בולטות בזירה העולמית ועוררו עניין עצום גם בכנס הזה, וזו למעשה הסיבה האמיתית שנבחרנו לארח את הכנס הזה, כי מבחינת בריאות ישראל היא מאוד גבוה במפה הבינלאומית. נפגשתי עם עשרות שרים, גם מנכ"ל המשרד פרופסור אש נפגש עם ראשי מערכות מכל אירופה, חתמתי על כמה וכמה הסכמי שיתוף פעולה חשובים, ואחרי הימים האלה לא נותר שום מקום לספק, ישראל היא שם חם בבריאות העולמית. אני שומע הכרה והוקרה באמת מעשרות מדינות למערכת הבריאות שלנו ומה שיש לה להציע לעולם. הכנס הזה היה בוסטר אדיר לקשר של ישראל עם אירופה ולשיתוף הפעולה בהמון תחומים בעולם הבריאות ומעבר, ועולם הבריאות היום הוא התחום המרכזי ביחסים הבינלאומיים. וישראל היא שחקן מרכזי בתחום הזה. יש לזה משמעות גדולה למערכת הבריאות הישראלית, למחקר, לפיתוח, לעסקים, לשיפור שירותי הבריאות שלנו בישראל, ויש לזה גם משמעות מדינית חשובה. Recently, the whole world received an important reminder of the meaning of partnership. COVID-19 and health emergencies are blind to borders between countries, race, belief, or religion. We are all there together. Another important factor in managing pandemics, and actually any health crisis, is equal access to health. I strongly believe in that with all my heart. Health inequality is a terrible obstacle in handling global emergencies. Disparities, חוסר שוויון in access to health services due to socioeconomic status or geographical location or political situation, they hurt the people. Today, there is no doubt that countries with strong state-regulated universal health coverage are much more prepared and protected from major crises. I commend the WHO and the regional director, Mr. Dr. Pluge, for their tireless efforts in promoting universal healthcare. Global cooperation is another asset that we must cultivate, and not only in the face of pandemics. Israel strives to be a significant player in the international community, and we have much to offer, particularly in the field of health. We seek to strengthen our cooperation with the WHO and WHO Europe in all aspects of public and global health, from emergency preparedness to digital health. This is one of the reasons for the initiative to start a process of opening an international center for digital health here in Israel, with the goal of sharing knowledge and expertise in this pioneering new field in order to make healthcare more effective and more accessible to everyone. Now, concerning emergency crisis, Israel seeks to play a positive role in tackling major global crises and tragedies. This includes providing medical assistance to Ukraine and adapting our health services in the face of global climate changes. Israel deployed a field hospital to the Ukraine in the beginning of the Russian invasion. Israeli doctors treated thousands of Ukrainian refugees. I visited there personally. Israel, as part of the free and the democratic world, stands with the Ukrainian people, and in my opinion, this is our moral duty. My hope is for peace and equality globally and here at home. My job is to maintain a strong, accessible, and equal public system for every person. Last but not least, one topic that is close to my heart is access to safe abortions. Abortion is not only a human right, not only a woman's right to make a decision concerning her life, it is also her right to health. It's a health right. In Israel, we recently passed new regulations that make it much easier for women to choose to have an abortion, with minimal bureaucracy and less state intervention in their decision. This joins a series of decisions we have recently took to equalize healthcare for LGBTQ people and promote services to transgender people. I see this as our main purpose, as the leaders of the healthcare system, as our basic duty. Finally, let me say, dear Dr. Pluge, health is becoming #1 issue globally. Everybody is talking about health. The challenges we face are many, but with each challenge comes an opportunity to sharpen knowledge, to develop technology, to improve practices. By working together, we can tackle these challenges head on and make the most of those opportunities that lay before us while building better healthcare for people around the world. I thank you very much.
Thank you very much, Minister, for your remarks. I'd now like to give the floor straight away to the Regional Director, Mr. Hans Kluge. Dear Regional Director, you have the floor.
Shalom, good morning. Thank you, all of you, for being here today. And first and foremost, a heartfelt thank you to your beautiful country, Israel, and in particularly the Minister of Health, Minister Nitzan Horowitz, for being an incredible host of my first in-person, my first physical governing board meeting, which is called the Regional Committee, since I became the Regional Director in 2019. Dear Minister, your support and hospitality have helped to ensure, as you were telling already, that this first in-person Regional Committee in 3 years has been an astounding success. The direct contact between the delegates after these tough years of the pandemic and exchanging experiences in such a wonderful environment is exceptional. I also want to thank the Director General of the Ministry of Health, Dr. Ash, and Director General Dr. Ashi, and the teams for the very, very hard work. What we're doing in these 3 days is that the 53 Ministers of Health, because I'm talking about the WHO European region, which is 53 countries, are coming together to make some very important decisions on new health policies to improve health and well-being and to be better prepared for any future emergencies based on the lessons learned from the COVID-19, with the overarching aim, which the minister stressed time again, of equity, meaning to leave no one behind. And I have 2 messages here. The first one was the theme of my annual address, which is the new normal. The new normal is called dual track. It means that all countries should be able to constantly maintain readiness and alert of emergencies, because COVID-19, monkeypox is not the last one, but at the same time ensure essential health services, because this has been the problem, that in many of our countries, actually the majority, independent of the income, be it in the West or the East, stopped screening services for HIV, for cancer, routine immunization. So we need this dual track approach, and that was the overarching message. On the emergencies, the pandemic itself is not over. Many journalists are asking me, has the virus now gone? No, the virus has never gone. It keeps changing. It keeps taking unnecessary lives. Last week alone, more than 3,000. But we are much better prepared. So there is really reason for optimism. The most important is that countries have a strong surveillance system in place, so they are able to quickly detect if there would be a new variant. Remember, knowledge is power, and that's why your country is so strong, because of the digital universal health coverage. The other very important thing is to administer a booster for the vulnerable people. We have to protect our vulnerable people and to target the use of the drugs we have to avoid people are getting at the ventilator. And I fully understand that the people are tired, that the people are frustrated. It has been too long, but we need to hold the fort so we can avoid any future strict public health measures. And it's possible if we work together. Let's also not forget, colleagues, that at least 17 million individuals, 17 million people across the region may have experienced what we call long COVID. These are people that when they got through the acute phase, for months and months have brain fog or tired or confused, having mental health issues. So it's not just the matter of dying or not dying, but to be able to pick up your life as before. Good news on monkeypox. The monkeypox number of cases is reducing in some countries. Too early for final statements. We cannot be complacent. The key issue, Minister Horowitz has been telling, and the whole Regional Committee applauds him, your minister, because he is always advocating for universal health coverage. We learned the lessons from the early days of HIV transmission for monkeypox, and the big lesson is the biggest enemy which stands in the way for eliminating monkeypox is stigma and discrimination. Minister, I cannot enough congratulate you for your visionary leadership. I myself immediately invited the LGBT plus community to do a joint press conference together with the European Center of Disease Control. I invited the leader of the Euro Pride events to our office and empower them to give clear messages to the people. Polio has resurfaced also in unexpected ways in our region and elsewhere. First week of August, I was in the United States, and Dr. Anthony Fauci was telling me the polio cases in New York are linked with those in Europe, and those are linked with Afghanistan and Pakistan, where polio is endemic. It means, again, what the minister was telling, a threat anywhere very quickly becomes a threat everywhere. And no country in the world can tackle it alone. That's why we are here together, under the tremendous leadership of Israel, for global collaboration and partnership. Now let me turn to the second leg of the dual track, which are essential services. This week's Regional Committee has shown the way. We have introduced very ambitious but practical roadmaps and frameworks to eliminate cervical cancer. There is historic opportunity to eliminate cervical cancer, including HPV vaccination, to end tuberculosis, HIV, sexually transmitted infection, and viral hepatitis. We also have an action plans to reduce alcohol consumption and target a range of what we call non-communicable diseases. Non-communicable disease means chronic diseases like cancer, like chronic respiratory disease, heart diseases, which kills 9 out of 10 people in our region. We also, and that I'm very proud of the leadership of Minister Nitzan Horowitz, who was one of the main co-sponsors of the WHO European Framework for Action to achieve the highest attainable standard of health for persons with disabilities. First time in the history in the region. This is an incredible landmark achievement. Then Monday noon, for the first time, during a ministerial lunch, we convened over 50 ministers with patient representatives, with the big pharma, and with insurers to discuss and get a mandate, and I got a mandate, so it's another achievement, a mandate to establish a public-private sector platform where WHO is the neutral broker to move towards a new social pact for equitable, sustainable access to affordable, innovative medicines. Because their colleagues, their friends, people are being pushed in poverty in my region because they can no longer afford these very expensive medicines. This is one of the #1 key issues. Israel will be remembered for this. And I'm very thrilled to note that the remaining 2 priorities of my 4 priorities also got a European framework of action, behavioral and cultural insights framework, and the digital health action framework. I was so impressed by President Isaac Herzog, who opened the meeting, because this is an example to other presidents that health is top priority on the political agenda. And he announced with the minister a WHO International Center of Excellence on Digital Health and Artificial Intelligence, where your country is far ahead, really far ahead. The key issue for digital health is not to have the latest fancy app. It is to help to improve health outcomes, leaving no one behind. And I would like to give an example that really blew me from my chair. At the Center for Digital Innovation at the Sheba Medical Center, where there was an app that allows pregnant mothers to see their doctors from home, and for midwives to check vitals on the fetus remotely, so that women in rural areas don't have to travel long distances. This is digital health in action, so that you save the people. Ministry, we stand in awe for this, really. Now I go to my second main message, that nothing of what I told is going to happen without investing in the health workforce. And I would like to take advantage to congratulate the health workforce in your country, Israel, and the whole region, who have given time and again the very best of themselves in these times of extreme tension. Basically, the COVID-19 exposed both the fragilities and the strengths of the health workforce. And that's why we are launching today the first ever flagship report on the status of healthcare in the region, with data from 53 countries, leaving no one behind. And most important, It's the style of Minister Horowitz and myself to be visionary but also pragmatic. It has 10 very concrete actions. I will give you an example. The biggest health workforce in the region are nurses and midwives. But we have to expand their role. Dear Minister Tolaraba, for tomorrow organizing at the Sheba Medical Center the regional meeting of all chief government nurses in the region. Because we know that our health workforce is aging. 40% of the medical doctors are close to retirement age. Israel, France, Ukraine, huge issues over there. So this needs to be tackled. Mental health of our workforce. We have to take care of our own workforce of the mental health. Long working hours, not always the professional support, serious staff shortages, COVID-19 infection and death rates among frontline workers, especially during the pandemic's early stages, all have left a mark to the days. This was the first thing I did to ask an applause for the healthcare workers in my address. Thank you, Minister, for support of your country to Ukraine. As you say, it's a country we have to continue to support. I'm very concerned for the winter coming. 3 times this year already I went to Ukraine, 3rd time to Chernihiv, close to the border with Belarus and the Russian Federation. 10 October I will go again with my colleague and good friend, the Minister of Health of Ukraine, Dr. Viktor Lashko. 6 days, and to see how we can help to prepare for the winterization. Frostbite, lack of electricity, of basic things. We have, as the Minister told, a moral duty to stand with brothers and sisters of Ukraine. I will finish with optimism. Like your Minister, I like very much. He's also optimist like me. Actually, it's a form of medicine. Just look at what we can accomplish if we put our minds together. I was amazed, Minister, as you were told yesterday, that it's not only inside the room, we have a great program, but outside. The people need to communicate in a safe environment, which you provide as Minister, not only successes, but also the failures. That's why I would like to finish with a quote in the beautiful Hebrew language from, I understand, a famous singer in your country, Arik Einstein, beloved both by the Jewish and the Arab communities. Ani ve'ata neshane et haolam. Together, you and I can change the world. Toda rabba.
Thank you. Thank you very much, Regional Director. And now we can move to the Q&A section of the press briefing. We have about 15-20 minutes. So we have, as I said, a roaming mic. If anyone would like to ask a question, can we get a mic here in the front? Please introduce yourself and who the question is directed to as well.
Good morning. My name is Karen Lechner from French daily Le Figaro. I have a question for Mr. Horowitz. You just announced on Monday the creation of an international digital health center. Could you tell us more about the way it will work, where it could be located, the budget it will have, and why it will be international? Thank you very much.
Well, thank you for the question. Digital health is a prominent subject in all the discussions, and all the countries are interested and are now investing into digital health, artificial intelligence, telemedicine, in general, using technology to promote healthcare for everyone. So this is a prime issue. And so this is our intention, in collaboration with the WHO, to open a center here in Israel to promote those issues, firstly for the region and also globally. This is the main priority of many countries. It is our priority in Israel, and we have a lot of experience and knowledge that we can share with the world. We have very good expertise, and as Director Kluge mentioned, we already implement many of the research into actual all sorts of equipments and practices to help people. So this is something that is going on now in Israel. We put a lot of money into it. Many other countries in Europe put a lot of money into it. And so it's just The next step is to create a center that will be based here in Israel and to concentrate the efforts for joint action on this matter. Thanks.
Yeah, Regional Director, you'd
Yes,
like to add
I
something?
would like to confirm what the minister was telling. Actually, before the COVID-19, digital health was optional, I say. And for the workforce, it's a mindset change. Not everyone is that fast like in Israel. And we know the power of digital health to transform the healthcare landscape. But now, after the COVID-19, digital is not optional anymore. It's obligatory. But we need front runners to show very pragmatic the way forward. Our WHO Director General, Dr. Tedros, was here for 1.5 days, and he also endorsed the plan. And as you say, Minister, it will go beyond our region with a global aspect. Thank you.
Thank you.
Thank you very much, Regional Director. So I'll just request as well to people online, if you do have a question, please do raise your hand. So should we take another question from the room? Anyone else got any questions? No. We can wrap up the press briefing then, if there's no questions online and no questions in the room. All right. Okay, thank you very much. This report is available in hard copy. My colleague Rami will be by the door for people who want copies of this report. And thank you very much for joining us.
Thank you.